Imagine your body is like a house with plumbing. Your heart is the pump, and your blood vessels are the pipes. Blood pressure is the force of blood pushing against the walls of these pipes, as your heart pumps blood around your body. In a healthy system, the pump works smoothly, and the pressure in the pipes is just right, not too high, not too low. This allows blood to flow easily, delivering oxygen and nutrients to all parts of the body. Now imagine if the pump started working too hard, or if the pipes became narrow or stiff. The pressure inside the pipes would increase. This is what happens when you have high blood pressure, also called hypertension. During pregnancy, high blood pressure can cause problems for you and your baby. To keep you and your baby healthy, it's important to get treatment for high blood pressure before, during, and after pregnancy. There are different types of high blood pressure in pregnancy. Pregnancy-induced hypertension is a rise in blood pressure without protein spillage in the urine during the second half of pregnancy. Pregnancy-induced hypertension affects 10% of pregnancies. Preeclampsia results when a woman experiences elevated blood pressure along with fluid retention or protein spillage in the urine after about 20 weeks of gestation. In addition to causing high blood pressure, it can cause organs like the kidneys and liver to not work normally. It usually occurs late in pregnancy, but it can develop in the late second or early third trimester. The symptoms of preeclampsia can last after delivery, but they usually go away within 6 weeks. Preeclampsia affects 2 to 8% of pregnancies. If preeclampsia becomes severe enough to affect your brain function and causes seizures or a coma, it is called eclampsia. In rare cases, preeclampsia symptoms may not start until after delivery. This is called postpartum preeclampsia. If this type of preeclampsia becomes more severe and causes a seizure, it is known as postpartum eclampsia. When a person with preeclampsia or eclampsia has damage to the liver and blood cells, it's called HELLP syndrome. It is rare but very serious. Last one, pre-existing hypertension is hypertension before pregnancy or raised blood pressure before 20 weeks gestation. It may be essential hypertension or, less commonly, secondary to underlying disease. Healthcare providers have different criteria for diagnosing hypertension, but in general, blood pressure that stays above 140/90 is considered elevated if you have no history of blood pressure problems prior to pregnancy. Protein in the urine, swelling, and the elevated blood pressure together are usually required for diagnosing for preeclampsia. No one knows exactly what causes preeclampsia, but it probably involves a combination of maternal, fetal, and placental factors. We do know that some women are at a higher risk for developing it than others. The following are risk factors for preeclampsia. Symptoms for preeclampsia can be seeing flashes, light or blurriness, headaches, vomiting, pain in the upper belly, usually on the right side below the ribs, pain between the shoulder blades, sudden swelling of the face, hands, or feet due to fluid retention. If you notice one or more of these symptoms, contact your midwife or OB/GYN. These symptoms may indicate preeclampsia or HELLP syndrome. Make sure you attend your prenatal visits so that your healthcare provider can monitor your blood pressure. Contact your provider immediately if you have these symptoms. Preeclampsia can be concerning, but by knowing the symptoms and taking prompt action, you can help ensure a healthy pregnancy for you and your baby. If you found this video helpful, please like and subscribe to our channel for more educational content. Thanks for watching, and take care.